So hello everyone, welcome back to today's discussion on Paget's disease. We will be discussing important points regarding the Paget's disease. So what all do you need to know? You need to know about the pathology of the Paget's disease and the causes of Paget's disease. So pathology and cause of Paget's disease, basically what happens in the Paget's disease, there is localized disordered bone remodeling. So there is localized disordered bone remodeling that is happening in the Paget's disease. Now, there is excessive bone resorption and there is disorganized compensatory bone formation. There are three phases for the pathogenesis. So it happens in three phases. There is the first phase, that is the lytic phase, where the osteoclastic hyperactivity is there. So osteoclastic activity is very high in the lytic phase, and there is increased rate of localized bone resorption. So increased rate of localized bone resorption is there, and that is why this is the lytic phase. So bone remodeling is increased up to 20 times in this lytic phase. Then there comes the mixed phase. Mixed phase is actually your lytic and blastic, both phases are there in the mixed phase. So there is compensatory osteoblastic activity. Compensatory osteoblastic overactivity is there, and there is accelerated bone formation in this phase. Then third phase that comes is the sclerotic phase. What happens in the sclerotic phase? In sclerotic phase there is thick and sclerotic bones. There are thick and sclerotic bones that are there, which are formed. These are woven bones which are very prone to fractures, and they are very hypervascular bones. Okay. Then we will study about the causes of the Paget's disease. What is the cause which is responsible for the Paget's disease? So the cause of Paget's disease is actually unclear, and it happens due to slow virus infection, that is due to paramyxovirus infection, or it happens and there is virus infection of the osteoclast. And another pathology is there is mutation in some genes, that is SQSTM1 and your rank genes, which are involved in the osteoclastic regulation. Okay, so this is the cause of your Paget's disease. What are complications can occur in Paget's disease? That is important. Osteoarthritis can happen. So osteoarthritis can happen as a complication of Paget's disease, because there is the alignment of the bone can be distorted, and that results in high wear and tear and degeneration. Then another complication of Paget's disease is heart failure. Why does heart failure occurs in Paget's disease? Because in advanced Paget's disease there is formation of the AV shunts, and there is hypervascularity that is increased in the bone. So due to hypervascularity of the bones, there is a risk of heart failure in Paget's disease. Another complication is neural tissue compression. So neurological complications can happen in the Paget's disease. Then rheally malignant transformation can occur, that is osteosarcoma. Osteosarcoma is another complication of Paget's disease. Okay. So these are the complications of Paget's disease. Next we should know about the signs and symptoms which are seen in the Paget's disease. So Paget's disease involves one or more bones, and it is not a generalized condition. And most commonly this affects the bones of the pelvis, affects the bone of the femur, affects your lumbar vertebrae and your skull bones. Okay, so that is the involvement in Paget's disease. There is a lot of bone pain in Paget's disease. Why does bone pain occurs in Paget's disease? Because of microfractures and periosteal changes. Then there are many pathological fractures that happen in Paget's disease. Another thing is bony malformations that are going to happen in the Paget's disease. So therefore there will be enlarged skull that is happening, that is tam o'shanter skull, and increase in head size is there. There is spinal bowing of the long bones. There is spinal kyphosis that is going to happen. There is bowing that is going to happen, and increase in localized temperature of the bones due to hypervascularity. Then arthritis of associated joints, hearing impairment, and decreased range of movement that is going to happen. How do you diagnose the Paget's disease? For diagnosis of Paget's disease, we can perform X-ray. So on X-ray, what you are going to find, the findings on the X-ray are very important. So there is osteoporosis circumscripta. What is osteoporosis circumscripta? There are well-defined osteolytic lesions of the skull. So there are well-defined osteolytic lesions in the skull that are going to happen early in the disease. And then there will be cotton wool appearance. The cotton wool appearance of the skull happens in the mixed or the sclerotic lesions. There will be Looser's line were also seen in osteomalacia. So Looser's line are also seen in Paget's disease. There are these Looser's line are actually the transverse lucencies resembling the fractures, and also known as pseudo fractures. There is squaring of the vertebrae seen on the lateral X-ray. So remember, there is squaring of vertebrae also that is going to happen in Paget's disease. So squaring of the vertebrae can be seen. Then tam o'shanter sign is an important clinical feature of Paget's disease. Just remember tam o'shanter skull. What is tam o'shanter skull? So tam o'shanter skull is enlarged overriding frontal lobe. Then candle flame sign is also there. Another important sign is candle flame sign. What is candle flame sign in Paget's disease? Your candle flame sign is a well V-shaped osteolytic lesion characteristic of the lytic phase. Then we see on the bone scan scintigraphy, we see focused increased radionuclide uptake. In case of lab results, results in case of lab results, what we see, there is mosaic pattern of lamellar bone on biopsy, and large numerous osteoclasts are there, usually more than 100, and affected bone marrow is filled with highly vascular stroma. Now, the diagnosis we have already seen. Now, blood test may alkaline phosphatase levels are increased. How do we treat this condition? We give medications, that is your bisphosphonates in case of your Paget's disease. So bisphosphonates are the drugs which are given in case of Paget's disease. Another thing that is given is your surgery is done for the correction of fractures, malformations, and physical therapy is given. So that was about the Paget's disease. In the notes you will get the images of related to the Paget's disease. Now we will, in the next video, we will learn about trichia.